All right, just so that way that's all there. Okay, so today is going to be about the overview of physiologic dentistry. Um, Essentially, it's comprehensive care with the physiologic connection. And just kind of a quick who am I? I'm Lily Bender. Am a hygienist for the last 7 years. Been doing physiologic dentistry for going on 6 years now. I didn't know too much about it when I got into the working field after the hygiene program. And when I joined this office that got me into it, I just really didn't know much about it. And a lot of my own personal symptoms, pain with migraines, jaw joint, um, was treated through physiologic dentistry and 1,000% better. And it's helped treat a lot of my own family members and patients. And so just wanted to share the knowledge and spread the wealth. So I did do a pre-course survey, and there were 15 recipients that did fill it out, and 11 out of 15 um, dental professionals did say that they have never taken any courses or training related to physiologic dentistry before. And 10 out of 15 have also either never heard of it, or if they did, they didn't really understand what is involved with physiologic dentistry. Um, so quick true definition. So physiologic dentistry, it's an all-encompassing holistic approach to help find the stable physiologic neutral zone. It's done by addressing the relationship between the teeth, the jaw joints, muscles, and the entire body's role in dental health. And there are five main focuses that are entailed with physiologic dentistry. And the first one being holistic health, and then prevention of chronic pain, enhanced quality of life, improved sleep and breathing, and then additionally, prevention of systemic diseases. And the number one reason being holistic health, it's just because it takes into account the entire body's health instead of just solely the teeth and the gums. It's a practice with the belief that health of the teeth and the mouth is connected to other bodily systems, and that includes your musculoskeletal, your nervous, your cardiovascular, and even your digestive system. And so with this, we realize the most important thing you can put in your body is oxygen. You can go, it's not food or water. Food you can go without for 30 to 40 days. Water, they say 3 to 5 days, but oxygen's 3 to 5 minutes. It's needed every second to keep your cells alive. And they show, especially with um, sleeping, if we're not getting enough oxygen, we're killing brain cells. So it's really important to be able to actually get that air into you. And so that intake of oxygen, it does start with our facial development. So overall, there's a lot more bones, but the skull is essentially divided into two portions. There's the cranial and there's the facial. And that facial is comprised of your nasal, your maxillary, and mandibular alveolar portions of your skull. And the growth of those bones is actually affected by things such as not breastfeeding, oral habits, allergies, airway obstruction, disharmony between stomatic gnathic forces, which are your chewing, your speech, your swallowing, your breathing. It's basically the functions of the muscles of your tongue, your cheeks, your neck, and all that fun. Um, but with oxygen being so crucial to survival, that quality of intaking oxygen is important and it needs to be at its highest potential. Um, and then the effectiveness and quality with intaking oxygen just, yeah, does start with that facial development. Um, and so gonna dive a little bit more into those. So that not breastfeeding. So our tongue is further developed with its muscle usage with breastfeeding, and it also affects the development of your masseter muscles and then the temporomandibular joint and the frontal growth of the mandible. And that's because the breastfeeding actually requires a baby to use those muscles to they use them intensively to create suction and express milk. And so bottle feeding actually requires less of that muscle effort, and less muscle activation equals underdevelopment of the masseter, and the tongue isn't trained how to be placed in the right position, if that makes sense. Um, because with that, the tongue should naturally know how to go to the roof of the mouth as well to help create a better suction force. And if it's not having to use that as much either, where it is with bottle feeding, we're going to see the tongue have poor posture as well. Um, and then additionally, with that underdevelopment of the masseter muscle, it does contribute to a weaker jaw because that jaw and those muscles aren't getting used aggressively enough to activate, essentially. And so it can later lead to poor alignment of the jaw joint later down the road as they get older. Um, and with that, also the breastfeeding also helps promote that jaw movement in multiple directions because they're trying to activate and stimulate to get milk. And with that jaw movement, it actually will help develop that TMJ, that joint correctly. And so, number two, with the oral habits, that's such as the thumb sucking and then even tongue ties. So, thumb sucking, long term alters your tongue position, posture, and function because the thumb pushes the tongue down and forward, but the tongue is actually meant to rest on the roof of your mouth, which actually naturally then helps shape your palate and widen it and help that upper jaw to grow wide and forward. Um, and then tongue tie or ankylosing, it reduces and alters normal jaw movement because it's restricting. And that can be whether it's a posterior tongue tie or a more anterior tongue tie. But either way, it limits that tongue with its positioning. And then allergies. So, the most common cause of chronic rhinitis that leads to nasal hyperfunction, and then that tissue inflammation and edema of the nasal and paranasal mucosa. What happens with that is it produces an excess of thick secretions that result in bacterial stagnation, which messes with then having chronic sore throats and earaches. And that impacts your sinuses with their growth and then those frontal bones because there's not enough air getting through. So your sinuses are going to be usually smaller or just so heavily congested that it's actually going to mess with, it's going to go actually messing with your adenoids and tonsils. And then those will actually contribute to some airway restriction. Um, and so, yeah, kind of a little bit better here. So, chronic rhinitis leads to your tonsils and adenoids not to shrink because over time, as we get older, they should naturally um, involute and shrink back into your esophagus. But enlarged adenoids become a mass on your pharyngeal wall of the nasopharynx. And so this is a perfect example. This is a healthy adenoid shrinking, keeping that airway open in the nasopharynx. And then an enlarged adenoid actually becomes a mass, which is blocking off that nasal cavity. So then you're not able to be a nose breather. And then you're forcing to instead become a mouth breather. And then the other importance with that about not getting the air through your nasal and becoming a mouth breather is it can even lead to sleep disorders, can mess with your cardiopulmonary. And so, and then with that blockage as well, it can also lead to mouth breathing, poor tongue posture, and then that can further on lead to dental malocclusion that we'll see, such as bicuspid drop off, deep overbite, crossbite, and then affecting your oral facial growth. But if it's caught early enough and adenoids are removed or if allergies are addressed, your facial structures will actually normalize without the need of invasive treatments. And then with that normalization, your nose breathing should be functioning back to normal. And that last one with the disharmony between stomatic gnathic forces. So that blocked nasopharynx, which means your mouth breathing, tongue thrusting, tongue is displaced, resulting in the poor maxillary arch development. And a bad arch causes disharmony of those forces of the chewing, your speech, swallowing, and breathing. Um, and so the TMJ joint itself is still developing in infancy. That fossa isn't actually developed. And that's where the breastfeeding becomes so important because as an infant gets older, that fossa is further developed. And so if that mandible isn't properly used, the fossa will actually become shallow and flat, where it needs to become deep instead. So that way that articulating disc has enough room and then it's shaped properly. So there should be hopefully later on no clicking or popping because that joint is properly formed in a correct shape. And so just wanted to show some examples of a poor arch development, which led to a poor bite. So this is what I meant by bicuspid drop off, where they're lingually inclined and they're out of alignment with the rest of the arch. You can see they're actually having another one actually on the maxillary arch as well. And then they even have an anterior start of an open bite. And then this one's showing that high narrow palate from poor tongue positioning, not helping push that maxillary arch open. And then, they could even have that oral habit of thumb sucking. But then same thing, you're seeing a anterior open bite. There's a start of a cross bite there as well. There's severe crowding starting as well. This one's the maxillary crowding, just back to that tongue, hasn't naturally expanded and developed that arch. And then this one's a posterior crossbite, definitely where, yeah, the tongue hasn't pushed out that maxillary arch, so then they're getting the crossbite, and then they're going to be needing to go into orthodontic work to help treat for that. And then one more with the bicuspid drop off. So this one is a perfect showing of that retrograded lower jaw where the mandible isn't protruded enough. You can see where her face kind of actually drops off and becomes shallow. And so bite affects your tongue position. So, and then your tongue position affects your airway. And so there's signs that you can see with airway being restricted, and that includes mouth breathing, cheek biting, biting of the tongue, that scalloping, and then chipping and breaking teeth. There's also other signs such as allergic shiners or the raccoon eyes, the darkening under your eyes. If they have a deviated septum, a steep mandibular plane, which is kind of where it just drops short, as well as a deep overbite. And then symptoms can include where they start to notice that they've got that scalloping of the tongue or it looks like it's being chewed. If they're having difficulty with chewing, speech, breathing, TMJ pain, which can be from compression of the joint, which compresses those nerve endings, um, and then as well as TMJ popping and clicking, which can be from either internal derangement, disc displacement, thinning, or even perforation or breaking out of the disc. And then another huge one that you will hear patients complain about is the locking of the jaw, and that could be locked open or locked closed. And then there's even overall body manifestations of airway obstruction, and that can include hyperkinesis, behavioral disorders. They've noticed that even severity of ADHD can be exacerbated with sleep problems. Um, and then poor eating habits, nutritional depletion. But that comes into if they're having trouble with the chewing and swallowing from those lack of development of those muscles and their arches, they're not going to be able to eat the way they need to. And then pulmonary hypertension, that's back to where we're not getting enough oxygen to pump that blood. And then the quality's not there either. So it's going to mess with your blood pressure. And then within that, there's the lowered oxygen saturation, and you will see signs of fitful sleeping and um, even we'll start to see sleep apnea exacerbated as well. And so within that, there are two differences with sleep apnea and sleep obstructed breathing. So sleep apnea is where the brain temporarily stops sending signals to breathe and they'll stop breathing and then they'll kind of almost choke and come back to breathing. Whereas sleep obstructed breathing is physical obstruction of the airway, such as the tongue falling back and blocking that airway. But both show usually loud snoring, episodes of that breathing and starting again, severe dry mouth that they'll experience, morning headaches, and then even cheilitis. And so both for screening is important. And there is a great way to screen for them. And there's two versions. There's the Friedman, and then there's the Mallampati. And so the Friedman is when the tongue is at rest or in its natural position. And there are five classifications. And the first one is class one, which is where a patient, when they open their mouth and their tongue's at rest, you should be able to see their uvula, their tonsils, all the way back into their throat, essentially. And then there's two sets for class two. So class 2A, you'll still see visualization of that uvula, and then but only part of the tonsils are seen. And then part 2B is where that uvula is starting to get blocked more. And you really only see the soft palate to the base of the uvula. And then class 3 is allowing visualization of only some of the soft palate, and it's mostly hard palate. And then whereas class 4 is just strictly hard palate is seen. And so when we're at rest, this is an important one, is because when you're at rest and your tongue's at rest, a mouth breather is going to have more of that class 3 to class 4 because when their tongue's at rest, it's falling back, it's blocking that uvula. And then it's blocking the nasopharynx within where it meets. And then the other one that we look at is your Mallampati score. So that's where the tongue is protruded. So we usually tell a patient to stick their tongue out. And with that, you still want to see the uvula and you want to see the soft palate. Class 2 with that one is that uvula is going to start to be blocked more. And then class three is where you don't see any of the uvula and you only really see the soft palate. And then just that fun reminder that oxygen is that most important thing to put in our body, because lack of oxygen can lead to hypertension, irregular heart rhythms, the pulmonary hypertension, strokes, daytime sleepiness, headaches, migraines, increased risk of dementia. It can even impact your weight gain and then worsen asthma. Excuse me. Um, so TMJD, there are the intraoral signs. That's those that include crowded lower anteriors, anterior wear and chipping, that lingual inclination of anteriors, and kind of like that bicuspid drop off where posteriors are tipped in, that narrow of the maxillary arch. You'll even see tooth mobility, cervical erosion, a crossbite, anterior open bite, and that scalloped tongue. But then extraoral signs that you'll see is bilateral face asymmetry, where one side isn't matching the other, a short lower third of the face, cheilitis, a dished out or flat labial profile, and then a facial edema. And so here are examples of the face asymmetry. Her jaw is not in alignment, and so it's off to one side, and she's not balanced in a neutral zone. Whereas after treatments, she was better in alignment. And then that short lower of the face, the shorter third, it's from that lack of that jaw development and the protrusion from proper tongue positioning. And then the cheilitis, which is a common sign with when our jaw joint's not right, we're doing the mouth breathing, we're going to see that. And then there are symptoms, so not just the signs, but symptoms with TMJD, and that includes the headaches, jaw pain, noise, clicking, popping. They'll have the limited opening even too, so not even a locked open or closed, but where they can't even open more than 10, 15 millimeters. They'll have chronic ear congestion. They'll have signs of bruxism. They'll notice if they have tenderness or pain on their face, but they don't tell exactly like what's causing it. You'll even see signs of cervical pain from their neck. They'll have posture problems. They can even have nervousness that leads to insomnia just because nothing can be at rest from that jaw joint overworking itself. And then even dysphagia or difficulty of swallowing. And so, why is it so critical to catch these negative effects? Well, overall, we want to prevent chronic pain. And that chronic pain is such as persistent headaches or even migraines, jaw pain, earaches, neck and shoulder tension, and then the facial pain. And then we want to help prevent congenital joint damage, such as the arthritis in the jaw joint, dislocation, and then the worst part of it is the degeneration of that joint. And if it can be caught early enough, then non-invasive treatment and therapies can be done. If it's caught where it's more severe, that's where you see more, where like an oral surgeon has to come in and help with fixing it. And so there are more than just a dentist as a provider in physiologic dentistry. It actually includes 6 types of providers, and those include physiologic dentists, chiropractors, physical therapists, myofunctional therapists, ENTs, sleep physicians, but that can also include pulmonologists, neurologists, and then your internal medicine as well, and then orthodontists. So physiologic dentists, they don't just focus on fix a tooth to make the bite hit better. and move on. They can do treatments such as TENS, which is a transcutaneous electrical nerve stimulation, and it actually helps relax those jaw muscles. And then with the dual usage of an EMG, which is a computerized jaw tracking and electromyography, we'll be able to monitor that jaw movement while those muscles are at rest. So you actually find where they naturally want to be. And so then you can help find where is that jaw optimally happy, which is then going to help make those muscles chronically happier. And then that bite's going to be happy as well. And you're going to see less damage to the teeth and their gums. And then just chronic pain as well will help be reduced. Um, Sometimes with fixing that bite, once you find the happiest place for that jaw, it is gonna need to be treated then with either an orthotic, and that can be a daytime one, or there's a sleep one, or even a sleep appliance that helps adjust that bite and keep that airway open. And then usually a long term would be restorations, but that's where the EMG is important because you don't just pick one molar and fix it. Usually it's more than that because the overall bite of either the maxillary or the mandibular arch need to be adjusted. And then they also focus on airway evaluations, and that includes you utilizing that Mallampati and the Friedman scoring, but they also have a CBT scans, and they'll even have either their own take home sleep studies or they're going to coordinate with the sleep center to get sleep studies done. And then the second provider are the chiropractors or physical therapists. And so they help tackle the pain management, jaw alignment, posture, and spinal health, um, which is important because if someone's been in chronic jaw pain and they've already been naturally like slouching and trying to adjust for that pain, they're going to have to get retrained, which is where the chiropractor and the physical therapist will help with that. And then the ENTs, they evaluate those tonsils, the adenoids, nasal passages in the throat, just to help diagnose any structural airway issues, including a deviated septum, turbinate hypertrophy, nasal polyps. And then within that, then they can help propose any treatment that may be necessary, that needs to be taken care of on the ear, nose, and throat side and not on the dental side. And myofunctional therapists, so they focus on the muscles and the usage of them. And those are the muscles of the tongue, the mouth, the face, tongue positioning, and then even swallowing patterns can even be retrained and corrected. A common one that they'll help take care of are tongue tie releases. And they'll actually do pre-release therapy and post-release therapy. And that's because they have to retrain the tongue, because when that tongue has been tethered and it gets released, it doesn't know where to go or what to do. And it's actually been known to fall back even more. And so they have to retrain it so that way that tongue knows where to go. And they can also then help with breathing, chewing, and swallowing, coordinate exercises to help strengthen and coordinate the oral facial muscles, which also in turn helps support the tongue as well. And then the sleep physicians, there's the pulmonologist, neurologist, and the internal medicine specialists. And they're just there to help diagnose sleep disordered breathing versus sleep apnea. And they do that via sleep studies and airway evals as well with the CBT, CT scans. And then usually if a patient is diagnosed with sleep apnea, they're given a CPAP, but they show that out of those that are diagnosed and given CPAP machines, only actually 33% of those with a CPAP machine will use them. And so if they can't tolerate that CPAP machine, we actually see it where sleep physicians then coordinate with a physiologic dentist to then create a sleep appliance. That way they can open up that airway without the restriction of a CPAP on their face or their nose. And then the last one is an orthodontist. So when trained in a physiologic approach, they are not only able to just align the teeth and jaws, but it's aligning that bite in a way that supports the whole body function. And it's not just that aesthetics of having the teeth be straight. Those the braces or even oral appliances such as the palatal expander or Herbst device um, is allowing to bring that jaw and the teeth into a position that then supports relaxed muscles and a proper function. Um, and then back to it includes expanding the palate to help open up those nasal airways, making room for that tongue so that way you can get into proper positioning and advancing that lower jaw so that way the tongue can also be brought forward, which then opens up that throat. So opening up that airway even more. And then correcting any bite imbalances that restrict the airway. Um, Coincidentally, I had a patient today that finished ortho 2 years ago, and her orthodontist wasn't trained in the physiologic approach, and her teeth were straight, but she, as soon as her ortho was done, was having severe jaw pain. She can't bite on the right side. She's actually having to wear a daytime orthotic right now um, to alleviate that jaw pain until she is actually done with college, and then she's going to come back and get retreated with a physiologic dentist and orthodontist to correct it, which is a bummer because she's gone through orthodontics already, but they didn't actually do what she needed for her body. And so the fun summary of why. So physiologic dentistry is more than just about aligning teeth. It's about restoring harmony between the jaw, the muscles, joints, airway, and then the nervous system. It looks beyond the bite and understanding of the dynamic relationship between oral structures, whole body function. And so physiologic dentists address the root causes of chronic conditions like sleep disordered breathing, TMJ dysfunction, headaches, and facial pain. And are there any questions?
I have one, Lily. First of
Mhm.
all, you did a great job. It's very informative. Um, okay, we're what? Oh, right here. So have you seen like a direct relationship between uh TMJ pain like later in life? And then have you ever just asked the patients like, were you breastfed? It's just like my mom has had serious TMJ issues. And
Yeah,
then just this week, her brother, my uncle, reached out to me and was like, my jaw's killing me. And just as
yeah.
you're saying this, I'm like, I wonder if they were breastfed, but it feels
Yeah,
awkward to ask my uncle if he was
it
breastfed.
it is an awkward one to ask for older adults, but usually too, it's kind of like once you've done an intraoral exam as well too, and you notice either a tongue tie or if the palate of their mouth is a little bit more narrow,
Yeah, he's very
then
narrow. So is my
yeah,
mom.
yeah. And so that's usually where we start to then further dive into those questions as well. Um,
Okay.
and sometimes they know and they're like, yeah, I've been breastfed or I have no idea. So
I know.
then you kind of got to go down the other rest of the kind of like signs and symptoms that we ask
Yeah.
about it. But usually, I mean, I was showing one, a lot of parents complain of, kids that grind their teeth and it sounds like breaking glass. Well, they've shown with physiologic dentistry a child should have no stress in the world, so we don't know why they're actually grinding.
Right.
And
Yeah.
it's actually usually signs that they're not getting that airway, and so they're grinding. That jaw's naturally already trying to get that airway open, and what happens is the teeth are getting hit in the process.
Interesting. I don't know. Like my grandma's still alive, so maybe I should just send a text to my 97-year-old grandma and ask her if they were breastfed.
You're right. Well, and that's I'll use myself as a perfect example. I didn't get breastfed.
Uh-huh.
Um, my mom had hers was just she had a breast reduction, so she had
Mm.
nothing to feed.
Yeah.
And so, and I never had a tongue tie, but I always had the chronic allergies,
Uh-huh.
earaches, sore throats, sinus
Hmm.
infections. So I was always, I find pictures of myself growing up just like breathing through my
Oh,
mouth the whole
yeah.
entire time. And you'll see these
Yeah.
kids with their lip seals not there and they'll have their lips
Hmm.
open. And that's where they're already subconsciously breathing through their mouth because that's all they know is how to get the air through.
They can just get more air. Hmm. Yeah,
Mhm.
interesting. Yeah. I had another question too about it's kind of when you were talking about ortho. Um,
Yeah.
is there is there a certain age or is it more like developmental maybe where it's almost like it's too far gone to fix with ortho alone? Or does it just
So
kind of depend on case by case? I mean,
it kind of depends on it's case by case. I see a 75-year-old woman who's actually going through instead of orthodontics, she's actually doing Sure Smile to help flare out her teeth a little bit more so her jaw's happier. And so it's never too late in age. It just depends on what's the severity and what's actually needed to be done. Like
okay.
she didn't really have a narrow palate. She doesn't have the tongue ties. Hers was just from her orthodontic 40 years ago. They
Hmm.
tipped her teeth in instead of allowing her maxillary arch to be tipped out. Um,
Okay.
and so that's I felt bad for the gal I saw today because she's 19 and already having jaw pain like this.
Yeah.
She was lucky to have a 15 millimeter opening, and within 30 minutes of cleaning, I had to let her put her orthotic back in for her jaw relief.
Oh gosh.
So yeah, and it's crazy how there's so many kids that I've seen, I say kids, that have the jaw pain and they're just like, oh yeah,
It's just normal for him.
it's just normal, or they're so used to it. And
Hmm.
I think we don't realize how much chronic pain we deal with until we're relieved of it. And then you're
So
like,
true.
why did
Yeah.
I have to deal with this for so long? Why did I wait?
Yeah.
And that was mine because I through high school, college, and working adult, I'd have migraines 4 to 5 times a week.
Yeah, I
And
do too.
yeah, and mine was always that fun jaw tension. And by about 1 o'clock, okay, I need to go turn the lights off, get the peppermint
Mhm.
oil, and call it a day. And we did the sleep study on me. We did the tensing and the EMG, and we were able to establish I was just so tense of pulling on those muscles. I was triggering temporal migraines.
Hmm.
And so I wear a sleep appliance now, and migraines have went away.
Wow.
I have one maybe once every other month.
That's pretty good.
So yeah, not having any more migraines, that was amazing. I felt like a new person.
Yeah, no kidding. No kidding.
So yeah,
Hmm.
and early detection is going to be the biggest thing for preventing later down the road with that. I had another one, she's 7, just turned 7. And her mom was more concerned about decay when she brought her in, and she hadn't been in for a couple of years. But when I asked the little girl what was her pain or concern, she said she had some sensitive teeth. And when I asked her which ones, she pointed at each 4 of her canines. Well, she was in a crossbite, and her upper canines were hitting up against the inside, the lingual side of her
Oh,
lower ones. And so her percussion was causing sensitivity and pain.
jeez.
And so, and then we noticed as well, like her adenoids were swollen, her tonsils were a little bit on the enlarged side. And her mom said, she never was a thumb sucker, but she is always getting over colds. So she not doesn't necessarily have allergies, but she's kind of always chronically sick.
Adjusted at
And
least or something. Yeah.
yeah. And
Huh.
so we did talk about with her and her mom that probably the best thing to do would be actually early orthodontic prevention. So refer to the orthodontist now, start a palate expander, um, start it
So do
while
you
she.
ask a dentist, like, are you trained in this? Like, how would you know if they're trained?
So there's different associations that are used for training physiologic dentists. The one that that we're trained with is the Las Vegas Institute,
Hmm.
LVI, and they're based in Las Vegas, but they train and have dentists specialized all over the US, and even Canada. So it just kind
Hmm.
of comes down, and I think there's two other big main um, associations that train for physiologic dentists. But
Hmm.
there's usually different outreaches. And then usually anybody that is usually a myofunctional therapist or even chiropractors, they're becoming more aware and working in coordination with physiologic dentists as well too.
Yeah.
So,
Did you know Jamie Rotuno?
yep. And she was trained with them too.
Yeah. Well, yeah, she worked with Jim McCrite, who's big in the Las Vegas Institute, and then she became a myofunctional therapist
Yeah.
maybe
It's,
4 years ago. I can't remember, 4 or 5 years ago.
yeah,
So she
it's,
talks about it, and then once she went through that, once she got trained, then we started having the students do Malin-Potty and have
yeah,
airway discussions. But like, I don't think most of us, besides Jamie, are super comfortable or know enough about it to have that conversation.
yeah.
So
It,
yeah, this
it
was
took
really informative.
yeah, it took a lot of training, um, and not only like role playing, but my dentist spent a
Yeah.
lot of time with me talking about, the cause and effects and why. And it made sense because the number one thing that, I feel like I would see with patients was chronic recession and erosion, but, they had healthy gums, they had good hygiene.
Hmm.
Like, where is this recession coming from? Well, if that bite's not there, it's gonna cause that percussion trauma, and then your gums recede from it. Um, the best way that I was always explained was, um, it's your tooth is kind of like a T-post in the ground, and that chronic wrong movement is gonna make that T-post loose.
Yeah.
And the first sign of mobility is recession because you're losing that bone loss.
Yeah. That's
And
a good one.
so,
I always like tell them that when you bite
yeah,
together, like the weak part of it is right here. You
yes,
know? So
yeah.
yeah.
He always said it like
Yeah.
it flexes. It's not actually strong and
Right.
straight, but it flexes, and
Yeah. I like the
that flexing
T-post
is
thing
what
though.
causes the notching. Yeah.
Yeah.
I
Hmm.
always teased it was what I get for being a horse person. Leg pressure with a horse, you press on one side, the horse is going to shy away. So our gums are
Hmm.
like that. Wrong pressure, your gums are
Hmm.
going to
Yeah.
recede. Unlike a
Yeah.
horse, though, you move your leg pressure, horse moves back, your gums don't, but you can
Right.
prevent it from getting worse.
Yeah. Huh. Really cool.
Yeah. Yeah. It was kind of the new world that opened up because we always checked and felt for the jaw popping, and if it deviated and you noted it, but it's like, okay, what now?
But we didn't do anything about it,
Yeah, you're like, oh yeah, it's
especially if they
there.
weren't in pain. It's like, okay,
Yeah.
yeah, note it and let's move on. Yeah.
Yeah. So it, and I don't think I can ever go back to not thinking with that physiologic mindset.
Yeah.
So yeah. Renee.
Yes, not really a question, but just a quick note. Lily sees a patient where we did a full mouth rehab and a nighttime sleep appliance, and we were actually able to show him his before and after CBCTs of his joints actually remodeling to where they're going to
Oh,
be happier. So, so cool.
yeah. I
Hmm.
really would love to get a CBCT scan. Like we had one in my office before I came here, and it's so fascinating to me. But
Yeah.
I mean, just like you said before at the TMJ, like, yeah, we would take it, but what would we do with it? You know?
Right. Yeah.
So, yeah, it's like
And
that whole follow through that is so important.
yeah. Yeah. And the Friday office that I work at, I I say old school, they don't believe in it. their
Most
traditional
of them probably don't.
dentist. Yeah. And so it's always hard. And then I get the patients like today that they talk about it. Like it's almost like a whisper hush hush because I don't the other dentists are like, that's not a thing, stop talking about it.
Yeah.
And so it's
Hmm.
it's it's a hard one, I think, for people to let go of like the old ways.
Yeah.
Because it's unknown territory, it's newer, but it always gets me on my soapbox of even insurance or just health overall. You know, our mouth is connected to our body, and so is our hearing, and so is our vision. And I don't know why they're all treated separately and individually.
Yeah, good point. Very good point. Yeah, just re-signed up for medical insurance, and that's an exact like if you want the vision and the dental, like they're very separate. You got to pay
Yeah,
extra. So most people
yeah,
aren't going to do it and just get by.
yeah. So
Hmm. Really cool.
yeah, thank you. All right. Any other questions?
I don't have any.
Okay.
Hmm.
Awesome. Well, thank you, ladies, for joining in. Sorry if you hear my dog screaming. Um, I will end the recording and then there is
So where
for
is the link?
so if I didn't let me get out of my screen sharing
Unless you
here.
emailed it and I just
Well,
being
I should
there.
have emailed it, but then um I believe I had added in the notes. Is it in the notes? I had added two pieces into it, but I can email them back again for the post survey if you would like it.
Yeah, if you don't mind, that would be great.
Mhm. Yeah,
And
I'll
then I can
send
do
that real
that for you.
quick. Perfect. Awesome. Well, yeah, thank you guys.
Yeah, thank you. That was real. I enjoyed that. That was really cool. So,
Awesome.
and then I
Thank
guess
you.
we'll see you in June.
Yes.
Okay.
Yes, I will be there.
Okay. I'm excited. It will be fun. It'll be
Yeah.
fun.
Yeah.
So,
Old stomping grounds. It'll be good.
yeah, it'll be.
I gotta get off, but I loved your presentation. I'll see you later. Bye.
Okay, sounds
Bye.
good. Bye.
So,
Awesome.
all right. Well, thank you, Lily. Yeah, email me that and then I'll do that post survey.